while we have you here, we want to just talk a little bit about COVID-19. Scientific advisor at the Broad Institute of MIT and Harvard, Alina Chan, tweeted yesterday that she heard new phrase permasurge used to describe the spread of Omicron and its subvariants in 2022. Can you update us on the status of any new vaccines that are, catering specifically to the sub-variants of COVID?
We know that both Pfizer and Moderna are trying to update their vaccine. There is talk about putting an Omicron variant in the vaccine that might be available in the fall, so it has the original strain and Omicron. There definitely is a need to update these vaccines because they're not able to block transmission the way that they could during the earlier eras when Delta was prominent, or Alpha, or the original version. There's also work to make a universal corona vaccine that would combat all coronaviruses and not have to be updated. So there is going to be a lot of innovation coming forward in this space because these first generation vaccines are not the last that we're going to see. Those are very, very effective at what they do, which is preventing serious illness, hospitalization, and death. But there's always room for improvement, and technology is going to progress.
And doctor, what do you say? What is your response to folks who have been talking about some studies that seem to indicate that there might be some concerns about waning efficacy of vaccines and boosters the more and more people take them over time, that there could be a diminishing returns or even increased vulnerability to the virus over time, depending on how many vaccines and boosters you ultimately take? Are those concerns with any legitimacy or that you've been following at all?
There's a theoretical concern that you can sort of prime your immune system to only respond to the vaccine strain, and it has difficulty being able to respond to other strains. And that's something that people have seen with influenza. And it's clear right now we're already getting diminishing returns. I don't think there's any danger to the boosting. I think it's just not a proper policy. I think we need to update the vaccine to get the appropriate protection. And we will see diminishing returns if we continue to use boosters against the ancestral strain and the immune system keeps getting hit with the ancestral strain when what's circulating is something completely different. There's going to be less and less protection as the virus becomes more immune evasive the way Omicron has.